What a beautiful puppy!
Isn't she? She's my first puppy. I decided to take the plunge.
Good for you.
This is her first checkup, so I'm a little nervous.
It's fabulous that you're bringing her in. I hope to give you nothing but good news, but that's up to you-know-who. Ready, doctor?
I haven't had a puppy since I was a little girl.
Normal for a newborn puppy. This is going great.
I'm glad you're taking care of Jojo.
Music to my ears. All normal. This puppy is pretty clean, too. Oh no! And I thought we were home free. Jojo may not like it, but it's the only way.
Jojo has been chewing up my shoes. Is there anything you can do about that? No, I just wanted her checked out. No, should I have? She's growing pretty fast. Did I do something wrong?
No, you brought her in, and we caught the problem. If all pet owners were like you, our jobs would be a lot easier. Keep it up.
Thanks, I'll try my best.
Jojo will thank you for it.
Good thing Kimmy brought Jojo in when she did. Puppies need to follow a regular schedule of vaccines, and Jojo certainly needed her roundworm vaccination. Without treatment, roundworms can be fatal. With your intervention and the owner's help, however, Jojo should suffer no long-term problems. The verdict is in. You made the appropriate diagnosis. You didn't waste your time with irrelevant questions. I'm pleased with how you treated this case.
Thank you for seeing us on such short notice.
Of course, we love to help people who love their pets.
You have to understand, Tango is very important to me. So today at the show,
Show?
the cat show, when she received her Best in Breed award, I noticed she seemed to have trouble breathing and I just don't know what I would do without her.
I know you're scared, but you don't have to be. The doctor will take care of her. You'll see.
Oh, please be careful. Oh, I couldn't even imagine it. Oh, she did win Best in Breed, you know. Oh, no, not that I am aware of. She keeps coughing.
Her nostrils are still flaring. Wow, her gums have turned blue. Oh, you can hear her wheezing. Tango isn't the only one breathing a little easier.
She's very special to me, and not just because she's a purebred. You work as gracefully as my cat moves.
That inflammation must be the problem.
Oh, I hope Tango will be able to enjoy her prize ribbons. I might recommend you to the other cat owners on the cat show circuit.
She's better already.
Oh, I am thrilled my Tango will still be able to show her talent. I hope she never has to go through that again.
She may have to. Asthma doesn't really go away, but I can tell with you by her side, she'll be dancing in no time.
When the lung airways constrict, asthma may be the cause. Excess mucus forms, airways swell with inflammation, all leading to breathing difficulty, and sometimes worse. Once this cat's owner learns how to recognize the signs, she can take early action to prevent a life-threatening crisis. Thank you for identifying the proper diagnosis. You understand the importance of asking the best questions. I'm pleased with how you treated this case.
What seems to be the problem, sir?
He's not feeling well.
His head seems to be leaning to the left. Can you give me a little more? Is he acting strangely? Is he not eating?
Yes, all those things.
Okay. Since we're not getting a lot from you, I'm going to turn this over to the doctor. Good luck.
My daughter wants dog healthy.
I like to hold China close and cuddle her, but now I can't. Can you tell me what happened?
Yeah, that's usually where you come in. As far as I can tell, it looks like she decided to take on the 3rd Battalion solo. Who the 3rd Battalion is, I couldn't tell you.
So you don't know what to do?
Of course we do. Well, the doctor does at any rate, and that swelling isn't going to go away by itself. Doctor?
China likes to walk and play. Maybe that is the problem.
Two small puncture wounds. Well, it's either a vampire or a rattlesnake. She could be in shock, or maybe she's just afraid of me. A swollen belly. Well, I'm guessing it's not due to doggy nachos.
You treat her like she were your very own.
Yikes! Hopefully that temperature will go down. Oh, and I'll never say yikes again. Abnormal blood test, puncture wounds, adding up to...
I would leave you alone to work, but she would miss me too much.
Drip started. I've got a handle on it, Doc. She's on her way.
You want to cuddle her too, I can tell. I didn't want to cuddle her because you look like it would hurt. Yes, her poor swollen face. China likes to stay close to me. We were in the backyard and she ran off for no reason. Then she yelped and ran back to me. That's when the swelling began. Come here, little China. Did Daddy make it better?
Daddy, you did make it better by bringing her in.
Can I cuddle her now?
You might want to wait to make sure she's fully recovered.
Just a little bit.
Oh, all right.
Apparently a rattlesnake was what lured China away from her owner, which may happen a lot. Although tissue damage can be severe at the bite, patients can recover with fluid support until the toxins are out of their systems. China's owner brought her in right away so that anti-venom will prove useful. If he had waited much longer, this case could have been a lot more serious. The verdict is in. You made the appropriate diagnosis. Your investigation of this case was admirable. Due to your treatment, this animal will recover in no time.
It looks like Happy can't hold his head up high. Wish his owner had mentioned Happy was falling over a lot.
You treat my dog well. He walks in circles. See it yourself.
He has tilted head.
He feels like a dog. Good. Good. My daughter wants dog healthy. You make Happy better.
This isn't a cure, but it will help with any motion sickness. Great job, Doctor. I'm sure Dimitri wants to thank you for taking care of Happy.
Goodbye.
Well, at least Happy is happy.
No one knows the causes of old dog vestibular disease, but it can be upsetting to owners. Fortunately, this condition will improve with no treatment in a matter of days. The patient is usually back to normal within a couple of weeks, though sometimes a slight head tilt persists. You diagnosed this patient accurately. You're definitely not afraid to ask for more information. You clearly know how to treat an animal.
Oh my goodness! What's happening?
That's up to you. She's been vomiting pretty much nonstop.
Did you feed her anything? Did she get into anything?
Not that I can think of. Hannah's normally in such good shape. We took her to the beach yesterday, and she was running around, took my towel with her, of course.
I feel so bad for her. You'd think I'd be used to this by now. Hopefully the doctor can take care of whatever's bothering her.
Tough day at the office, eh? I wish it was abnormal. Well, okay, she doesn't normally vomit a lot. Now I think there's some blood in it too. No, should I have? Not a thing. So how many dogs do you treat in a day? I bet lots. I don't envy your job, but then again, I doubt you envy mine.
Oh, poor thing is anxious. Pale gums, just like the eyes.
Do you do everything this well? I don't envy your job, but then again, I doubt you envy mine.
I love my job, but it would be better if animals never got sick. It's so sad. That can't be good. We have to do something right away. A little of this means a lot less discomfort for Hannah.
You're doing a better job than Hannah does on my slippers.
I was worried myself.
It's a relief you could do something about it. I'll never go to the beach again, that's for sure.
Never?
Okay, I'll go, but only because I know Hannah is safe and sound at home.
Aspirin has many great uses, but only for humans. Sometimes humans make the mistake of giving medicine to their pets, but it looks like Hannah maybe ate an aspirin she found on the beach. With aspirin in her system, Hannah could experience not only vomiting, but also internal bleeding and kidney damage. Hannah will need to be monitored just in case there are complications. Although one medication caused the problem, antacids and other appropriate medicines that you prescribe will be the cure. I agree on this diagnosis. Your questions were thorough and relevant. Good job. You used the right tools for the job.
We've got a rat in today whose name is...
Renfield. I know, very funny. Can we get this going?
It would be nice if we knew more. He could be fine, he could be ill, he could be wondering why you brought him here. No, actually, that's us.
Okay, he hasn't been eating and he has a little diarrhea problem. Does that help?
Well, it's a start. Let's see what the doctor has to say.
Renfield keeps me sane when I work too hard. Must be great to be a vet. Didn't touch him. Let's see. He's been drooling a lot and he hasn't been keeping food in his mouth. Good enough? I can tell he's lost weight, so that's why I brought him here. So let's get going.
Drooling can be cute, but not to anyone I know. Aha! Of all the problems that could have caused this, a nasty virus, a very mean owner, it's the teeth. Well, that's lucky. No parasites. Molars are overgrown. No surprise to me, of course.
It must be hard treating a rat, since they're a lot smaller than dogs and cats.
Yeah, we won't want him awake for this.
I definitely need to be more on top of taking care of Renfield. I've just been so busy.
Well, now you'll be extra busy, making sure he's eating enough, that he's gaining enough weight, that he's...
I get your message loud and clear. Thanks, Doc, for helping Renfield.
Nice job. Looks like you cleared up more than just one problem.
As you can see, not keeping up with a pet's dental care can have far-reaching consequences. Renfield was eating so little food, he started to lose weight and became susceptible to infection. Once those sharp points on his teeth are gone, he should be well on his way to eating up a storm. I agree on this diagnosis. You didn't waste your time with irrelevant questions. I'm pleased with how you treated this case.
What happened here?
Don Quixote was running after one of the ladies.
You have another iguana?
No, literally. One of my ladies was over.
Uh-huh.
Okay, my sister was visiting. She noticed there was this lump here.
Was that so hard to say? Hopefully it won't be as hard for you, doctor.
I don't go around feeling my pets, but there is that swelling. Big swelling there might be kind of a clue. Seems pretty normal to me. Just an FYI. Sometimes he bites for no reason. It's hard to find a vet who can handle an iguana as well as you, Doc.
This swelling fits with what Richard said. I'm surprised. That white substance feels hard. We're on to the real problem. Don't want any more infection getting in. Now we can get rid of that abscess. I always like to go the extra mile. Don Quixote won't miss this. He'll heal much faster now. Because of that culture, we know that this is the right medicine.
I'm glad Don Quixote is ready to go. I'll keep an eye on him and the swelling, since he can't do it himself.
Make sure to come back and see me sometime.
Oh, really? Well, I was going to ask if...
I was talking to the iguana.
I knew that.
Although an iguana qualifies as an exotic animal, treatment for his mass abscess doesn't differ much from other cases you're likely to encounter. As long as his owner regularly administers the antibiotics, Don Quixote will be chasing the ladies again in no time. You diagnosed this patient accurately. You're definitely not afraid to ask for more information. You clearly know how to treat an animal. You certainly started out of the gate with a bang. Because you've been treating your animals so well, you've already earned yourself an award. Keep up the good work.